This video is about giving activated charcoal in the context of a colchicine overdose. So colchicine is a gout medication that is extremely dangerous in the context of overdose. It inhibits mitosis of dividing cells. This leads to liver failure, renal failure, and then to multi-organ failure, which progresses to death. If that doesn't kill you, then it also causes bone marrow suppression, leading to neutropenia, which causes sepsis, and the sepsis also leads to death. Now, there's no antidote for colchicine, so it's absolutely critical to give charcoal early on in the course of the presentation. The people at increased risk of colchicine toxicity are those who already have liver or renal failure, and those that are on a drug that interacts with colchicine, particularly if it inhibits one of the cytochrome P450 enzymes that breaks colchicine down. You should offer activated charcoal to anyone who's taken a colchicine overdose of more than 6 milligrams or more than 0.1 milligram per kilo. Or if they are at increased risk, then if they've taken more than 0.05 milligrams per kilo, they should be offered charcoal. You should give, which means they have to have it under a duty of care, and it's not something you can argue about or debate. You should give activated charcoal to anyone who's taken 20 milligrams of colchicine or more, 0.3 milligrams per kilo of colchicine, or 0.1 milligram per kilo if they're at increased risk of toxicity. And you should do this even if it requires sedation and intubation and delivery via an NG tube. The other thing to remember is to call a clinical toxicologist as early as possible if you suspect a colchicine overdose, as it may be in the critical early stages of presentation where you don't want to miss an opportunity to intervene and save someone's life.